Today's August 23rd, 2023. I'm honored to have with me Dr. Kat Lindley. Tell us about yourself and what you have been working towards.
Well, thanks for having me today. I'm a family physician in Texas. I have my own independent practice, direct primary care, and I've been involved with different things even before COVID, but relative to COVID, I've been involved with Global COVID Summit Group, and also I'm president of the Global Health Project.
So tell us, what is the Global Health Project? When was it created? And how has your role been, um, I guess, given wings or had freedom, given that you are an independent physician?
So Global Health Project came together last summer. It was an initiative of different thought leaders, activists, physicians, scientists, teachers, moms, dads. We kind of came together to discuss how do we change the narrative at the time, and how do we get more people to start realizing that not everything that's been happening for the past few years has been exactly on up and up, right? So we actually wanted to tell a story, and we were trying to figure out who should tell the story. Should it be children? Should it be parents or grandparents? Or should it be physicians? Um, I actually thought that children should tell a story, because I felt that during the pandemic, there was a lot of damage done to kids in school with lockdowns, masks, the uncertainty, fear, and all that. And I felt that their story would be compelling. Some felt that it should be physicians, some felt it should be parents, but we actually ended up doing a survey. And the survey said that people still wanted to hear from doctors, despite the fact that they feel that doctors have, to a certain extent, abandoned them or maybe not done their diligent duty. They still felt they should hear their side of the story, and why some of them realized that not everything was the way it should be, and how did they, I hate the word wake up, but for it kind of makes sense here. How did they wake up from this narrative, and when did they realize that things are not right? So we end up doing this video. We have on our website globalhealthproject.org. We have 60 seconds, 2 minutes, 8-minute video of different health providers and their journey to realizing, whether it was mask or CDC guidelines or FDA or NIH or some articles on treatment or vaccines or whatever it was. How did they decide that not everything they're hearing is right? So we're sharing these videos for other people to see, and for them to realize, if these doctors could be fooled, it's okay that I was fooled. But what do I do now so it doesn't happen again? And with everything that's happening, with yesterday's news that one of the universities in Atlanta wants to go back to mask mandates, to these new strains that are coming out, to new boosters for the fall. How do people empower themselves to be able to say, that doesn't make sense, I'm not going to do it this time? So that's kind of the reason Global Health Project is out there, to make sure that we help people find their journey in this confusing world, and then to empower them to be able to protect themselves and their family.
Excellent. So how do people find that, first of all, and who's involved with it, and what are your, I don't know, what's been your reception so far?
So it's globalhealthproject.org, and we have several board members that are listed, on the website. We have a psychologist. We have a someone who's been in the marketing business for a long time. We have, like I said, parents involved and things like that. So we are fundraising on our own. No one is really funding us. You can get involved by going on our website, with sharing your story. We're going to have actually something coming up in a week or two regarding the Maui fires. We're going to do a big fundraising event for that. Mm-hmm. So, our really hope and role is to try to bridge this big divide, and to kind of get people to don't feel like they're alone, whether they want to take charge of their health or their finances or the kids' school education or their faith, their growth, whatever it is. We want to be able to empower them to do that.
Now, people can tell your accent is not quite from Texas. Can you tell us about your journey? What's informed you, and what's given you kind of the ability to challenge and be strong in the face of prevailing narratives?
So you mean to tell me that my y'all is not really authentic? I'm just kidding.
It's authentic. I think to
Or all y'all?
maybe
Yeah.
someplace in Yugoslavia it's authentic too. So.
No. So I was born in Yugoslavia, which is now Croatia, and I left Croatia when I was 18. I actually just turned 18 that year and graduated high school and left to live in Italy as a nanny and then a little bit in England and came to the States. But the reason I left was because we were on the brink of the war, and I left one day before Split, which is my hometown, was attacked. As many people probably are aware, we were under this Balkan War for several years. So I grew up in communism when I was, Tito was still the president of the, I forget what we were called.
Youth League.
Yeah, it was like, the Socialist Republic of Yugoslavia, whatever it is. He died in the 80s. So I grew up under communism and, I have memories of that and certain things that I remember you could do, you couldn't do. And like one of them was, I'm Christian, so like you couldn't really discuss that you go to church because, there is a big separation between state and church in
Yeah.
communism. It's kind of frowned upon. And then when he died in the 80s,
Marshal Tito.
Yeah, Josip Broz Tito. We had this 10 years of uncertainty because Yugoslavia was made up of 5 republics and 2 provinces. So everyone kind of tried to take charge during that period of unsettlement, the Croatian leaders, the Serbian, Slovenians, and stuff like that. And then the war, there were rumblings of the war. There was lots of, there were these, satellite attacks or whatever. And interestingly, the world always thought that this was a war about religion because Croatians are Catholic, Slovenians are Catholics, Serbians are Greek Orthodox, and then Bosnians are Muslims. But it was really never about that religion. The war was more about who was going to take charge of the finances and all that because Croatia brought in a big chunk of money into the country. Slovenia did as well because they had industrial. They had industry and mountain tourism, and then Serbia was more of a, flat lands, and Bosnia as well. So it was really about who's going to take power over this region.
Yeah.
And it was a devastating war because essentially you had cousins fighting cousins. Because before the war, I had relatives who are from Serbia, from Bosnia, and different parts. So it was a difficult time for all of us. But one thing that I remember thinking after that whole thing is, it's kind of interesting that my interest now lays in WHO, United Nations, and things like that. I always felt that like UNICEF and the foreign meddling into the war made things worse. And that's kind of what we're seeing now with different things happening around the world.
Yeah. You have a lot of different forays that I've looked into. I was privileged to meet you in June in New Hampshire. And I've since looked into some of your work and talks. I'd like to maybe focus on a couple things you have up. first of all, you've mentioned the UN just now, and then also you're talking about at various points their project in One Health. Can you tell us what is One Health according to the UN? It's oftentimes a lot of the a lot of the most benign sounding names have underlying meanings. But what is One Health for people who may not have heard of that?
So One Health is actually by the World Health
I
Organization.
apologize. Well, the WHO is part of the UN, so
Yeah. WHO is really the health arm of United Nations. I'm actually while we're talking, Googling their definition of One Health. So their definition of One Health is integrated, unifying approach to balance and optimize the health of people, animals, and environment. So it's calling for collaborative efforts of multiple disciplines working locally, nationally, and globally to attain optimal health for people, animals, and environment, including climate change, right? So that's their definition of what they think One Health is. Essentially, One Health is really their way of trying to control what's happening. It's like I like to say, it's one size fits all approach, and to them there is no difference between health of people, animals, plants, or environment. Right? There is no distinction. Yeah, that's exactly right. So this one size fits all approach, obviously, as we've seen through pandemic, is not the way that I would say most physicians, at least the ones who are treating patients, would like to go, because we realize that patients are not numbers, they're humans, and everyone has different set of circumstances and risk factors and things like that that needs to be taken in consideration. One big things with WHO, what we for the before they used to recommend, you should do, like, even the masking thing that they're trying to reinstate now, or the PCRs or vaccines, whatever they recommend. It used to be recommendations, but with what's happening right now and the new negotiations of the treaty and the amendments to the IHR, they're trying to make these recommendations into obligations, where each country member state, which we're one of them, would have to comply. And you would have this entity that has nothing to do with your country or with your health department, kind of mandating how we do things. So, in my opinion, obviously, it's a big red flag that we definitely should not comply with.
So where do you see if we take, if this thing were to kind of linger and roll out and so forth, what liberties and so forth, what are the worst case scenarios you see envisioned by this?
So there is a real danger that this will happen. People talk about pandemic treaty as the big issue, and it is a big issue, but it's actually not as big issue as the amendments to the IHR. So pandemic treaty, if you take that, pandemic treaty will go into the World Health Assembly next year to be voted on, and I believe they need 2/3 of their assembly to pass it. And then the treaty, because it's a treaty, needs to come to the Senate, United States, to be ratified. So obviously we kind of have check and balances there, where hopefully the Senate will not ratify it and they will not adopt it. But then you have these amendments to the IHR. The amendments to the IHR have already been approved. I mean, the international health regulations, we've already approved them before. They were amended in 2005, and those amendments were also approved. And now they're just doing these amendments to the IHRs. They don't have to go through the same process.
Amendments to what?
International health regulations. So these international health regulations are part of the international law that we have already adopted. So right now, there's different countries, including our own, have submitted amendments to the IHR as it stands. Those will also be voted on in May of next year. If those are approved, those actually come into play because we already are complying with the international health regulations. So that's where the real danger is. Some of these amendments and the treaty, they kind of work hand in hand. One is more policy, the other one is more like instrument to get all this implemented. But together, what they will accomplish is if there is a issue somewhere in the world, the Director General could proclaim, I forget the exact wording right now, but international incident of of concern.
Right.
It has the actual name, and I'm sorry, I don't remember the exact.
Well, they have a PHEIC that,
Exactly.
public
But
health
then
emergency of international concern.
that's exactly right, right. So he could proclaim that, and then from there it could escalate into being the actual pandemic or whatever. And once that happens, the Director General would have powers to actually dictate how we respond, whether it's as a country because it's in a certain region, or whether it's as a world because it's all over. And that includes the potential treatments, diagnosis, vaccines, travel passports, closing the borders, anything. And that's kind of where some of us, including David Bell, who I know you had recently on, will say, well, we feel that that's an attack on national sovereignty. Because if you have this international body coming and telling you, we're having a pandemic, we're having an international concern in this area, you guys need to close the borders, you guys need to do this, you need to put a certain amount of your budget into doing this. That is someone telling a nation how to operate, and that has to do with an attack on national sovereignty. But WHO is really smart. They say recently, Director General has pushed back on that and said, pandemic treaty is not going to attack anyone's national sovereignty. By itself, it's not, but with the IHR, it will. So, like I said, there is a big concern, especially with international health regulations. And I think there is every indication that current administration is going to vote for all of this as yes, because they submitted most of the amendments. And that goes through the HHS, the Health and Human Services Department. So yeah, I think it's a big deal because as we're seeing now, like I said, they're trying to reinstate the mask mandates in certain places. And some colleges still have vaccine mandates.
No, it's a craziness. And, for my taste, there's SARS in 2003, then SARS in 2019. Those are illnesses for the elderly and severe potentially without a vaccine, you can argue. But for the vast majority of population, without comorbidities, it's, nothing. It's kind of a bad cold, bad flu. And I think in Israel, the data have come out that, ages 0 to 49, with no comorbidities, the actual death toll was 0. And that's a pretty low percentage. For probably half the country, 5 million people or whatever, or more, 7 million people, 0 deaths from coronavirus. So somebody can declare something an illness, and then if there's a blur with One Health for other types of human actions, which, peripherally will affect health, and you can argue that everything's going to affect your health, whether it's air quality or, interpersonal relationships, or the ability to define, kind of restrict abortion or restrict transgendering, or allowance for transgender surgery. I mean, the list can go on and on. And these things can become, a huge lever by which to, change policy all throughout the world. I want to don't want to spend too much time on diversion, but you did mention the PHEIC, and that was the term applied to Zika microcephaly as a worldwide concern after the Zika microcephaly pandemic, as it were, in 2015, and then edging into 2016 Brazil. Now that turned out, in my view, to be a totally factitious, fallacious exaggeration of a presumed conjecture into quote unquote science. Nobody's rebutted it, refuted it, overturned it, reformulated, even as Zika has not caused microcephaly anywhere on Earth ever since. But at the time in Brazil, it was used as a bludgeon, in a sense, getting to Catholicism here. Brazil historically is a Catholic country, a good part of Latin America as well, and they're sort of ground zero for the pro-abortion legal funds and NGOs and so forth. And a lot of people feel as if right to abortion is women's rights, women's reproductive rights, and so forth. And if the UN gloms onto that and it, kind of gives it significance as a health thing, in this case in Brazil, there were literal legal challenges all the way up to the Brazil Supreme Court to allow emergency injunctions to allow abortion, which otherwise not. And there are all kinds of emergency dictates. The WHO sent physicians to Latin America and the Caribbean and so forth to push for birth moratoria, so women would stop having pregnancies at all or completely until there was a Zika vaccine. And so there was a huge political kind of laying on to this presumed pandemic. Now, I don't think that one was real, but people still think it is. But it didn't stop people from getting all kinds of political add-ons. They all want to jump on jump on the car and go for the ride. So I think, to your point, I think there's a lot of things that can happen that can be deemed public health, but oftentimes they're there perhaps as Trojan horse kind of front runners for other things that people want to get by the nation's laws that they haven't been able to do so here.
Well, yes, there is definitely concern. And the biggest thing is, who is WHO to decide things like that, right? Who is WHO to decide whether a nation has too many births or there is a risk and they shouldn't, give birth anymore? I just think that we are giving too much. Let's say that their intentions were good at the beginning. If you look at their funding at the beginning, the funding was given by the nations solely to the WHO, but now the funding is all the private-public partnerships, right? And one of their biggest funders is Melinda and Bill Gates Foundation and Gavi Foundation. So all of these foundations that actually somehow seem to benefit from all this are the ones that are funding these things. And people always cynically say follow the money, but it's really true. And again, even as a doctor, when it comes to any type of treatment, I've always felt, so before COVID, I am very much against socialized medicine, Medicare for all type medicine. I always felt that that's one way for totalitarianism to really overtake the country, because if you can control this big industry, you can kind of, if you control the health of your population, you can kind of control a lot of things.
You're controlling the access to health.
Not only that, but you can talk about longevity of the population as well, right? Some things that Canada is doing right now are very much in question. This made the assisted suicide thing happening. So I was always against one size fits all, because in medicine, as a clinician, you don't look, well, obviously on periphery, you keep in mind what's happening to the outside. But when you're taking care of someone, you're taking care of that live person in front of you, and you have to do whatever is in the best interest of that person. So I would say, public health definitely, I had a podcast with Jay Bhattacharya, and we had a really great conversation. Obviously, he's a public health, guru, and I'm really just a clinician, a family medicine physician. And we both, I would say, looked at things from a different point of view, but we both came to the conclusion that even that, and as we should as physicians, one life matters.
Exactly.
Even just that one life, it matters. So I can understand the role of public health, especially if it's coming from our own, country, from people who are seeing what's happening and they're trying to do the best they can with what's happening. But a lot of times in public health, there is this. They've gone away with not many physicians, not many clinicians, not many people who are actually seeing patients are truly involved in public health.
Mm-hmm.
So you end up having this whole generation of officials who are not really, physicians. They've done public health policy. So they're great at epidemiology, they're great at numbers. But I can tell you, I always use this example. When I read a story, this is kind of, it's hard to talk about, but like when you read about a child being molested or hurt, and you read like 14-year-old boy and something happened to him, when you're reading 14-year-old, you're like, oh my gosh, that's so sad. But when you imagine your child, because I have a 14-year-old, when I superimpose my child into that role, it hits you differently.
Mm-hmm.
Because you are not imagining a number anymore, you're imagining a live human being. So I think like there is a danger in public health. Even with good intentions, people become numbers.
Exactly.
And then you look at what is the best for the large number of people instead what is the best for Randall Bach or
Mm-hmm.
Kat Lindley or someone else. So I think in my opinion, there is a big need to humanize public health because of the fact that they've removed themselves so much from some decisions they make. I think they don't realize that, like I said, even one life matters.
Yeah, exactly right. I agree with you. First of all, my pact, I'm a primary care physician, and I had my I practiced for over 30 years, and we were taught there's the doctor-patient relationship. That is your sacred bond. That's whom you treat and how you're judged and so forth. And you should always try to do your best and understand, medicine in general and the science behind your motivations. But there were never any mandates. Even if a certain treatment was the right thing for somebody's illness, it has to be factored in with what the person wants and what's the right situation for that person. You have to be able to validate and back it up and discuss it. But I'll just give one quick example. It could be that, I don't know, the best thing to do for a patient is have immediate bronchoscopy. But your patient might be 87 years old with kidney failure without the strength for that or interest, and resigned and consigned to different management. And that person might abjure it, might decide not to do that therapy or treatment, whatever it is. And that is that person's prerogative, and it's not for you to force yourself upon that person. What we saw a lot here was mandating, and we looked at things on a population level. And I think that a lot of these things were done with a bigger type of, the word population from same root word as police and public. They're all from the people, the polis, in Latin. And I think oftentimes people will take on the mantle of doing something much bigger and better while they are trotting on certain lives and rights and individuals. And I think it's kind of like almost kind of which way you turn the I'm trying to think what it is, but anyway, it depends, whether you look at it from top down or bottom up, and I think rights are rights, and they cannot be abrogated and divided up as some kind of spoils system for people with political motives and political gains. Because at the end of the day, those people in larger roles, centralized roles, they can manipulate the statistics whichever way they want. Think we've seen this with COVID. there's an old expression, what are you going to believe, me or your lying eyes? I think people had their own perceptions of colds and flus and so forth. But it was not the zombie apocalypse that came through with COVID. People were locked down. I think most people realized they were, locked down peremptorily, meretriciously, inappropriately, and so forth, and they surrendered it for the greater good. And people were berated and cajoled and so forth, in doing everything for the greater good, as if somehow, my not having a vaccine was going to affect somebody else's having one. And when we're in different places, different ages, and so forth. And I think this actually gets to your point about some reasonable fear of national health insurance and so forth. We don't have national car insurance. You drive your car, you insure your car, and you take care of it as well or poorly as you like. Obviously, we have some interest in your car not being a total wreck because you're going to go on some public roads with other people around. But how much you insure your car and to what extent you want to keep up with it or keep it around is up to you. If we nationalized car insurance, I would start to have an interest in how well you took care of your car and when you should get rid of it. And I think that actually kind of pertains to a lot of things we've seen in Europe, with the push towards euthanasia and a lot of things, when people are no longer kind of providing, they're an expense, we should get rid of them. And I think that factors in kind of to a kind of a less kind world, to put it very succinctly. That what we have is a world that is run by bureaucrats and decided by dictates. And I think this is the problem ultimately with a lot of nice sounding things like One Health and World Health Organization and all this kind of stuff. I think they have not done well by people. I think they have been corrupted by certain pharmaceutical monies and so forth. And I think they've gotten away from the kind of maybe more benign role they had at the incipience of the United Nations and so forth. So that's not a question. I apologize, but I'm going to ask you on a personal basis. When you treat patients, how much does your role as kind of a leading voice and a physician? How does that dictate the people who come to you? Have you had people not come to you for their physician care because of one thing or another? And how did you kind of navigate the world of vaccine mandates and so forth?
Well, I live in Texas, so obviously the vaccine mandates here did not last too long. There were some businesses that needed vaccines and things like that, but most of them allowed people to use the religious exemption or things like that. So that wasn't like a huge issue for my practice. And I left the system. I used to be medical director of a big clinic. I also worked for university, and I also worked for private practice. I kind of experienced different systems of practice, and I decided in 2017 to leave that and do direct primary care, which is a membership-based practice. I don't take insurance. I'm opted out of Medicare and Medicaid. So, and I started my practice from zero. I didn't really bring any of my patients from the other practice into it. And I'm a firm believer in free market. I think really to restore trust in medicine, the physicians have to become independent. They should not be employed by corporations, hospitals, or universities, because then they have to kind of comply with whichever dictates come from the matrix, as I call it. So, I've been on my own since 2017, and I think in general, because of where I live, people appreciate that. So I'm still, taking patients. I'm still getting a lot of new patients. I'm really by myself in practice, which is kind of nice. And I would say before, when I was in the system, like I'm pretty much straightforward, I'll kind of tell my patients, I can lead you to water, I can make you drink. And I've always practiced pretty much that way. And before in the system, some patients didn't really like that because they want you to hold their hand and how it is, like, oh, if you do this, I'm going to report you to a sprout or whatever. So I don't think they really liked my straightforward approach. But because it's my own practice, and I would say they all know it the way I am. So for where I am, I think I'm doing great. I love what I'm doing. I love my patient population. Most of my patients are friends of Facebook. And I live in a small town just outside of the bigger town. So I have people coming from Dallas and other areas as well. But I like what I do, and I think they appreciate that. And since I like what I do, I think they can kind of feel it. So, and for me, like you said, the most important thing is the patient-physician relationship. So I'm not one of those that will give you medicine for everything you need. A lot of times if you say, oh, I'm trying to lose weight and stuff like that, I always say, okay, write down the list of all the things that you eat, including the snacks that you steal from your children. Because as parents, we do that all the time. We finish our kids' meals because we don't want to throw it away. So, I always try to look at plus, I'm a DO, I'm a osteopathic physician. So our approach to medicine is a little bit different than our allopathic counterparts. We were taught from the beginning to look at body, mind, and spirit. We actually do manipulation for certain ailments. And then I'm from Mediterranean. So for me, the way of life is kind of part of your health. So, you know, it's been really good. I haven't had much trouble at
Hmm.
all.
Well,
And the running joke is like when I talk to a few patients, is like I'm trying to stay out of trouble because I am outspoken. But in a sense, I just try to tell the truth. Especially like when it comes to this whole last few years of pandemic, I see it through different eyes. I see it definitely through medical eyes, like through medicine issues, but I also see it from my own childhood experiences of communism. You know, this whole build back better that was initiated at the beginning of pandemic. Like, have you ever seen every leader of every country say exactly the same words? No, they shouldn't be. They should be taking their own country in consideration first and then decide how to respond to certain things based on what's best for the citizens of the country. Instead, we had the whole world pretty much. It's almost as like the switch was turned and everyone started singing the same song, which to me never made sense. And I've always said it, like even if you listen to me speak from the beginning, I always said it's not about the isolation, mask, social distancing, vaccine. It's always been about a mandate because a free country should never mandate anything of its own citizens. So,
yeah, no, I think you would. I'm with you. If there's an argument to be made um, for a mandate if the threat were big enough. Um, in the United States, I think George Washington mandated his troops. It's before the United States existed, to get. Actually, the origin of the term vaccination is from vaccinia, variola, which was the cowpox version of smallpox. So so they cross pollinated themselves or whatever. They vaccinated themselves with boils from other cowpox individuals, and he wanted his troops to be immune to smallpox because that was a huge threat for the integrity of his troops. And so everybody in the army apparently had to do that. That was not the whole country, obviously. That was a branch. You can maybe
well, they still continue that in the military, right? And I think when you sign up for military, they're aware that they will have to,
right,
not that it's right or
but for the
or
entire
not, but
population, no.
yeah, because like if you start mandating things like this, what if they mandate that there was an article recently about 20 cities where you're not going to be allowed to eat meat anymore. Like you can have three set of clothes or some nonsense like that. What if they say like there are too many mouths to feed and you can't have more than three children? I have five. What am I going to do to my other two? It's like, there is certain things that should never be mandated. And if you're living in a free society, but if you're not, which obviously seems like we're not only us, but no one is, then yeah, they can do whatever they want. And I think they're
No,
showing us
I
that.
agree. Um, there's Woody Allen is a young filmmaker in the 70s. He produced Bananas. I don't know if you ever saw the movie. So it's ostensibly a banana republic, and he's one of the. It's basically modeled after Cuba and Castro. And so the charismatic young leader, the Fidel Castro type, takes control of the country, and it's a Latin American-ish kind of place. And his first, everyone thinks everything's going to be better. So he has a mandate right from the get-go. He mandates this and this and this, and his last mandate is everyone has to change their underwear every single day for health reasons. And they're like, well, how are we supposed to know? If you've done that. He says, well, from now on, good question. From now on, we're going to wear it on the outside so we can check. And it's just, this concept that, one man's mandate for whatever reason, is not, it does not cross applicable. And I think, the previous popes, I think understood this. I'm not sure about the current, just to kind of touch on Catholicism. I think there are, in Catholicism, I've been doing, having somebody on who talks about Latin America, Venezuela, and other countries recently on my podcast. And I've been researching kind of liberation theology. And there's this concept where a lot of organizations, including Catholic Church, have been inverted. So we have to think on a population basis rather than an individual basis, rather than individual communion.
And once you do that, once you start thinking of the society instead of an individual, that's when you lose the I'm trying to find the right word. This happens to me all the time. Where I can remember the English word. No, you lose the worth of a life. Like you lose the concept of how much life is worth. And I think we need to come back to this. It's not even an idea, to principle that every life matters. Mm-hmm. There are movements for everything. This life matters, that life matter, color red matters, color blue. No, every single life matters. Even if it's like, that 98-year-old who actually is probably at the end of life. Every minute of that life matters. And we need to honor it. And this is kind of where I go to public health. I'm obviously, I realize the value of public health. I realize the value of guidance, but guidance are not rules. And I think one of the biggest tragedies that's happened, and this pandemic showed it, is that public health officials have lost this principle that every life matters, because the life has become a number. And I'm telling you, when you look at stuff as numbers, you detach yourself from it, you lose your own humanity. And that's kind of where we are in the mess that we are. Right. Because, if you read, like, let's say, even the mask mandates, and I'm not going to talk about whether masks work or not. I have my opinion on that. But even if they 100% worked, what if you have someone who is an asthmatic and who cannot wear a mask because they actually would put them into, an attack, or someone that has panic attacks and asthma, and then you put something constrictive, it gets worse. You cannot look at everything.
Absolutely, you can't look at everything through the same prism.
No, you have to look at the both. And you have to realize.
I think decisions are much more sensible on a personal basis. I play squash and I play tennis, and I belong to a squash and tennis club. And during COVID, I thought it would be sensible. First of all, there's a selection bias for people at this club to be relatively non-obese and non-smoking. If you're significantly overweight or a big time smoker, you're not running around the tennis courts or squash courts. You don't have an interest in late middle age when you have the money to belong to this club in doing this. So it's already a pre-selection of reasonably healthy people who can do aerobic activity, blah blah blah. Nonetheless, even though it's a above average, healthy cohort because it's a health club, people did not allow personal abilities or personal interests to prevail. Early on, we have squash courts with 20-foot ceilings. It's huge spaces, and it's ventilated, and there's an open gallery at the top. It's not like you're in a little tiny box. And I was playing people in squash early on, and we both agreed to be on the court, and then we're fine. It wasn't intimate contact, and so forth. And ditto on the tennis courts, which are outdoors. Yet, the club did what other places did, like golf course and whatnot. They closed down for, I don't know, a month or two. And when they came back, everyone had to have their own tennis balls. They're wearing masks on the court. It was just a silliness. And just to kind of get to your point, I was sitting outside at one point, and two guys, both physicians, and both in good health, they had been playing a squash game. And I played a lot of squash in my days, and I know these guys, and they can run around for, good 3, 4, 5 games. They came out exhausted. They're panting. They ripped their masks off. And I'm like, wow, that must have been an exhausting match. They're like, match? That was one game. And so, so they were 5 times more exhausted because they're wearing a mask while they're doing aerobic activity. This is
they've
absurd.
lost their minds, right? Because even as physicians,
I know
they should have known that, like,
absolutely, they're both physicians.
Like that. Yeah,
exactly.
But even even the measure, like when they decide 6 feet apart. I don't know if you actually read the story how they decide on 6 feet. They thought that 3 feet is too little, 9 was too many, so 6 was okay.
And that's called the Goldilocks principle.
Yeah, so it just everything was designed to put us in this state of fear, so that certain measures can be implemented. And the ridiculous thing is, it's kind of funny because this whole thing about masks is not coming from the government. It's not coming from WHO, from what I remember. I was trying to read stuff from WHO. They are talking about variants. They're talking about concerning variants. But the ones that are instituting these new mask mandates are university. There is a acting studio. There's a studio in LA that's instituting. So you have these organizations who actually, I don't know who decided. HR decided to actually do it.
Yeah.
They're like, oh, the virus is coming, and let's put a mask on because that really is going to work.
Yeah, for good length of time, people here were sort of during the Afghanistan war, people saying, "Oh my God, look at the women! They have all their women masked. They don't show their faces. How absurd is that?" And at another time, they were looking at Egypt and talking about clitoridectomies and saying, "Oh my God, how brutal is that?" Here people are cutting off the sexual function and partially genital excision on women. How barbaric is that? And here we kind of fast forward 10, 15, 20 years. You don't hear anything about Egypt's kind of genital mutilation, because we're doing a fair amount of genital mutilation of our own, or a different religion perhaps. And as far as masking, it has its quasi-religious aspect here. I don't think it's for modesty per se. It's for fear. I'm not sure which is worse. In either of those cases, I'm not sure which is worse. I'm not trying to condone clitoridectomies or masking in Afghanistan, but we do very similar things for different reasons, but the reasons I don't think are any better.
I think the most important thing, going forward, and that's kind of where the Global Health Project is trying to do some work, is to show people through things that we've learned that some of these things don't make sense. We shouldn't do them, whether it's masking, whether it's the boosters, whether it's just in general what's happening, because we don't want anything like this to happen ever again, right?
Yeah, I agree.
And I think what people need to realize is your body knows what it's supposed to do. If you take care of your immune system, you take vitamins, you hydrate, you sleep, you decrease your levels of stress, your immune system should be primed enough to take care of any viral illness it comes across. And if there are issues and have some risk factors, then you should be able to have a physician who, based on what you need, will decide whether you need to be treated, whether you need to be put on some kind of support or whatever it is. And it's really important for people to kind of, I always say, if your car breaks down, you're not going to go to the garage down the street. You're going to ask your neighbors, your friends, look at the ratings and decide who you're going to have fix your car. It's kind of the same thing for the doctor. Don't just go to any doctor off
Yeah.
the street. Talk to your friends, neighbors, find someone that shares the same values, because that's really important. There is every indication that things are going to progress from here. So best thing we all can do is just take care of ourselves, take care of our families, our neighbors, and
Yeah,
really
and
try
so,
to live life without,
right, without the
having.
insanity. No, I agree with you. We also, unfortunately, we also need like a supernumerary immune system, not just an internal one. We need an external immune system to kind of keep out some of the lunacy and some of the absurdity. That requires knowledge, intelligence, experience, and or barring those, at least the right people whom to trust. I'm going to just put this up on the screen for a second. This is an article I wrote a year ago, a little more than a year ago. It got published in September 2022 in the Daily Skeptic. I think, frankly, it should be in the New England Journal or something like that. A year ago, people were coming up to me say, "Oh, I got COVID-19 again." It was 2022. I mean, it's even more absurd, 2023. That people are talking about Omicron as if it is, the ancestral version. Here we have in the bottom corner, there's the ancestral version. This is the alpha, beta, delta, the second wave VOC, variants of concern. Omicron is sui generis. It's its own spontaneously derived coronavirus from Southern Africa, and it does not really related genomically to the bunch that was SARS-CoV-2, which is pretty close to SARS, classic SARS from 2003. And this is from nextstrain.org. There's really very little in the way of posited, lineal descendants from the other coronavirus. And even if it were related, the Omicron lethality is minimal. It's on par with a common cold. And speaking of which, coronavirus was always the second most commonly named cause of common cold. This is from 1999, before SARS was a thing. So there's rhinoviruses, coronaviruses, and then a whole bunch of other ones, unknown and whatnot, influenza A and whatnot, influenza B, I guess. But there's very little reason to think that Omicron is, first of all, related to SARS-CoV-2. And if we didn't have, already in advance the endless, swabbing and testing we have for coronavirus, we would not think of Omicron as anything but a common cold. So if we went back, we could, kind of do Men in Black mind ablation and go back to a cozier, happier time in 1995. There's nobody would be on alert, and Morris Brown University, or a college in Atlanta or no place else would be thinking about putting masks on for the cold. I mean, they have young, healthy people, and that they can get on with lives. I mean, people need to live. There's no life without some illness, obviously. But people have taken it very much to the extreme for their own, I think, lack of benefit, their own.
And as we all know, the new viruses, new variants, and things like that, they can be very rapidly spread and all that, but they're not as dangerous as the first variants, right?
Yeah, I mean, I think that's
So
I think there's somebody's law in virology and so forth that basically you're going to have huge danger, or you're going to have transmission. So you either have virulence or transmission. If something's hugely deadly, you can't pass it around because everyone's dropping dead. It's like knocking over the bowling balls, and they can't knock over other ones. You just want to, it's a little bit more like.
and again, like our bodies are made, our bodies are work of art. Our body knows what to do. If you take care of your body, if you take care of your immune system, in general, it knows how to clear an infection. And if you have risk factors you need to worry about, then there is treatment for things. Depending what happens, one of the biggest issues with COVID-19 was the secondary bacterial infection that no one was treating for it, right? So you had these people who had COVID, and then this viral infection ends up developing into a bacterial infection because the immune system was already too much down to do anything. And it seems like doctors have forgotten how to practice medicine. We've always known that the viral infection can lead in bacterial infection. Instead, originally the initiative was to tell people to stay home until they can't breathe and stuff like that. And at that point, it was sometimes too hard to bring them back because of too many risk factors and the attack on the system. So I would say, and I think like if you go on social media, most people are pretty much saying the same thing. This is this new narrative from UK, from us, and from different parts of the world. New strains we need to be concerned with. Most people are just deciding to live their life and not go crazy over anything like that.
Fair enough. All right, so I'm going to close things out. Maybe just have you touch on the Hippocratic Oath, what you think of it, and we'll say goodbye to our audience soon.
So I actually rewrote the Hippocratic Oath about a year and a half ago, I think it was. I don't know if I can find it. But essentially, Hippocratic Oath is very important for someone like myself. Like you said, patient-physician relationship is a sacred bond, and we should take it seriously. And first thing, I always think of those words, primum non nocere, first do no harm. And that's what physicians should do. It's really kind of sad to see state of medicine as it is right now, with different indoctrinations in medical schools, residencies, realizing that FDA, CDC are not necessarily up and up, and that really lots of stuff that they've been telling us are not right. That I think was hard for many of us to come to that conclusion, because we were always, when you're in medical school, it's almost like if you're reading a Bible and someone tells you, oh, Jesus is not the savior, right? It was kind of the same type of learning, realizing that you can't really trust the agencies to the extent that we used to trust them. So it's really important for every doctor to remember why they went into medicine, and that's where Hippocratic Oath comes in. So my advice to everyone is to find a doctor that they trust, someone that they consider a friend, someone they know that if something happens to them, they can come and confide to. And those type of doctors are the ones that truly believe in the Hippocratic Oath.
Okay, so I'm going to just close out by going to Global Health Project here. This is globalhealthproject.org. And I think you have the oath. I'm not sure if that's Hippocratic Oath. But
that's the video. There's different stories. And I can't talk too much about it, but we are in the process of trying to do a fundraiser. So please watch our space.
Okay. And here's your Twitter page. And,
yes. That's my Twitter page. I try to be good, but every once in a while I get frustrated.
Yeah, as do we all. And here's people can help support my podcast by purchasing my book. It's called Overturning Zika. It's on Amazon. And you don't have to read it, but you should buy it. I'm just kidding. You should do both. You should read it because it's an amazing story. It's basically like a Fabergé egg. It's a perfectly formed bit of kind of panic and hysteria that we can see from a little bit further out, full 8 years after the fact. So we're not in the middle of the Zika microcephaly pandemic. Nonetheless, even though it has never recurred, even in Brazil 2016 as a phenomenon, it's still in the WHO lexicon and everywhere else on Earth. There's a huge research establishment, and they're not backing down. They have something called CZS. They've moved the goalposts to something called congenital Zika syndrome, even though it's exact, co-virus. Zika is a dengue virus. There are 4 dengues and one little tiny Zika is a 5th dengue. Dengue has never caused any of these things, and Zika doesn't either. But the attachment was there for all kinds of political reasons initially, not just because people actually wanted money and equity to go to Brazil's poor northeast. So a bunch of doctors formed a group looking and hunting for a new novel virus. They were actually hunting for chikungunya. They didn't find it, and Zika became the replacement virus, and they were off to the races. And so here's Overturning Zika. For the same price of admission, you get a picture of me on the cover. I hope you buy it, enjoy it, and let me know and rate it and review it. Anyway, thank you so much, Kat Lindley, for being with us, and I hope to see you shortly. I'm going to be in Dallas in November for Brownstone.
From Brownstone, yes.
Get to see you there. So thank you very much. I appreciate your time.
Thanks for having me.